Coming up on Why Should I Trust You? If another pandemic were to hit our shores today, how many of us would comply with government orders again? With being told to stay at home, with vaccine mandates in order to work at our jobs, with social distancing rules, with remote learning for our children? On today's episode, we play out a different scenario. What would a different approach, one that's more targeted with a lighter touch, actually look like? Would more people simply die? Or would even more people comply? One country tried such an approach, Sweden. The results? Well, we're going to get into it. Today, we bring on the architect of that plan, Anders Tegnell, and we ask him, where does personal responsibility clash head-on with the responsibility of public health? Let's get started. Welcome back. Welcome. I'm Brenda Adhikari.
I am Tom Johnson.
I'm Maggie Bartlett.
I'm Dr. Mark.
Yes, so just to review, Brenda and I are journalists. Maggie is a virologist. Mark's a doctor.
I just have to first start off by making sure, have we checked our group chats and making sure there's no people we don't know in our group chat, guys?
I didn't recognize Mark, but I think he's clear. He's good.
I'm good on the people, but there's some emojis that I have a lot of questions about.
Oh my God. So listen, we have a really good episode today. Anders Tegnell, for those who don't know him. By the way, I'm saying his name Tegnell like I know how to say a Swedish
That's
last
our first
name.
question to him. Is just like, how do you say your name?
Yeah, it's going to be a really good conversation, y'all. I think that Anders he's sort of become this folk hero for many people in this country of how Sweden handled their pandemic. I don't know that all of that makes a lot of sense, even to him. But before we get into all that, we want to talk about a few other things that's going on in the news right now. Look, with some of these funding cuts, we're now venturing into a part of the cut story that feels, I'm just going to be honest with our audience, like it feels kind of crazy to me. I saw a headline that now the cuts are for like a 30-year diabetes trial that I guess Columbia University was like mainly overseeing. And because of the administration being pissed off at Columbia for being what they believe is promoting anti-Semitic policies, they're now cutting through these like a diabetes funding program.
Yeah.
I'm just trying to I just don't get it, honestly. Mark.
I think a lot of people don't get it. I think there's still so much that we don't know about the cuts. And I think that's the problem. So on the one hand, you have people saying, oh, you're just, fear mongering. They're not going to do anything. Everybody's going to be fine. But on the other hand, we do know that there are cuts coming because first of all, everybody that I've spoken to at HHS and CDC and NIH, they're bracing for impact. They know that we've just seen the tip of the iceberg on cuts. I mean, we're still like right now as we're taping, we're in the end of March, but on April 14th is going to be a really big day because on that day is when the OPM, the Office of Personnel Management, basically said that you have to outline a positive vision for a more productive agency. And on that day, we're going to start to really find out what is actually going to be cut that's going to have a real impact. And we're not even there yet.
Everyone's having to make choices about can we do these experiments or do we need to safeguard for salaries for people to continue? And we're even considering, how many grad students can we take? And that's the lifeblood of research. So if we don't have a good, sustainable model for people to keep doing research, it's going to come to a screeching halt.
And a lot of this is like federal, like we're talking about federal funding, but I don't think a lot of people realize that there's this idea of pass-through funding so that you have the federal government sending money through the CDC to the state. So like the CDC's budget, that doesn't stay in Washington, D.C. or CDC headquarters in Atlanta. That money, and it's not a little piece of pie, it's $9 billion that gets sent out to the states so that they can do what they need to do. Like, the measles outbreak. I mean, if you just look at this measles outbreak that we can't stop talking about, last year, Texas got $43 million for public health emergency preparedness. So now you say, okay, let's take that away. You pull out the rug from under these health departments that rely on this money. Like, how are they going to handle the measles outbreak? I mean, right now they're saying it's going to take them a year to handle it. And that's with all the resources they have.
Right. And it seems like every direction you look, there's a cut story. There's funding cuts occurring. Like in the CR that passed at the last, the 11th hour, there was a huge cut to this Department of Defense fund, which again, you're like, Department of Defense. Well, it's a major funder of research across the country, of medical research, scientific research. And that's been dropped 57% now. So
I mean, this is stuff
Yeah.
Tom, that we rely, like all
right,
diseases,
that's cancer research, right? That's
multiple sclerosis.
MS, that's veterans health research. I mean, it's like it runs the gamut. And then you've got like where the administration's angry at institutions for other issues, and that money's frozen. And then you've got Doge, which is like this country's like, what is it, like $36 trillion in running a $36 trillion deficit. Like they're trying to like claw back money, and research is being cut in that. So
and they're accidentally cutting things like the Ebola research,
right,
and they added it back. But every cut has downstream effects. And
I think, I always like to put myself in the shoes of the person who has the problem with the system or whatever. I'm even going with the thread of like, okay, you think USAID, some of its funds goes towards things that don't make any sense to you, like transgender operas or like even fighting diseases in country. And again, I'm just like giving the benefit of the doubt to this argument that like you're giving funding to diseases in countries that are far away. What about things here at home? Okay, so let's talk about things here at home. We are now seeing cuts to domestic food assistance programs inside the United States of America. We're seeing cuts to veterans benefits. We're seeing cuts in contracts to farmers. These are all Republican base voters. And I'm even hearing from some RFK Jr. supporters, Maha supporters, who are like not super psyched about some of these cuts and who are saying things like cutting cancer research and cutting diabetes research is cutting research into chronic disease. And that is a priority for this administration. You had Donald Trump talk about it at his congressional address in the spirit of like wanting people to succeed and not just kind of throwing attacks at people. If we truly care about chronic health in this country, we wouldn't be cutting cancer research and diabetes research right now. If we cared about farmers and veterans, we wouldn't be cutting benefits to them right now. Like keep USAID and countries around the world out of this for a second. Truly. There is an argument to be made that is kind of transcends politics in this moment.
People see the word cutting and they're like, oh, it's just, we're not going to spend that money and that's good. But cutting doesn't necessarily mean saving. You are actually making a bad decision by cutting. You're losing investment and you're not saving anything. So going down to zero isn't really cutting if the cost of all of that is
there's a back end cost.
Exactly. Much higher.
Right.
And I think one of the things I would just say is that another back end cost is that we're crippling innovation. Like this doesn't stimulate people to want to innovate in any research capacity. And we need that innovation to drive solutions forward for chronic diseases.
Right. You're turning off a whole generation of researchers who are now looking for other opportunities in other fields. You're ceding ground to countries like China who are like, fantastic, America's pulling up stakes. You're getting out of research, genetics, disease, future pharmaceuticals. We're all in. Great.
Yeah.
That's a really interesting point, Tom.
And I get that Maha isn't driving this. And if they're aware of it, why aren't they putting their newfound muscle, voice, energy into screaming about this? Like we're talking about, events about making our baby food, more healthy, just like Europe at the White House. But like, meanwhile, we're cutting cancer research for kids or rare disease or investment in future drugs that could profoundly change life in America. Right here, where's the Maha voice? Like, why aren't we seeing marches on Washington right now? Like, or the equivalent online? Like,
right. To be fair, I am hearing from folks just in my text chains and things like that in my Signal app, truly, about, just being kind of not okay with this stuff. I don't know that anyone wants this. You know what I mean? Right. Like there are things that we do want. I read a quote from a scientist being like, yo, you want to reform NIH? I will be the first in line to see reforms to that place. Don't cut my cancer funding. Now, I will say one last point, which is I think it's something to think about even in this place that feels like you're cutting funding for all these really important diseases, that there is concern that some of this research is funding things that can't be reproduced and funding things that aren't good studies. And I think that those are really worthwhile to look into. But Tom, it's like you and I were saying, it's like suddenly taking air traffic controllers away while the planes are in the air That's
Yeah.
kind of what it feels like in this moment,
Right.
you know?
Right. Totally.
Okay, so we wanted to talk about that. All right, so now we want to move. This is what's called a hard pivot. We're doing a hard pivot, y'all. We are today wanting to talk about a really big component of what is driving mistrust for science and public health, mainstream science and public health today, which is this notion that during the pandemic, people were telling us what to do, and we did not like it. They were telling us what to put into our bodies. They were telling us whether or not we could keep doing our jobs. They were telling us whether our kids could go to school or not. Tom, just take us through kind of a quick reminder of like what America's response was vis-a-vis these mandates.
Yeah, and it'll be a brief dip back in time because we all lived it, and I don't think we all want to relive
remember it.
So, but as you know, important to kind of set up, is there an alternative way to do this that could be a North Star for us in the next pandemic? But when a pandemic emerges, researchers say there's two critical questions that have to be answered right away, which is this transmissible and is it deadly? And with COVID, by about the middle of February of 2020, we knew the answers, and this wasn't good. This was bad. So we all remember middle of March, those stay-at-home orders kicked in. America shuts down. We're trying to slow the spread. Those overwhelmed hospitals, God, it was a night. We're living a nightmare. And that sort of began us on this journey of shut down, try and reopen, new variant, shut down again. But Mark, do you want to just kind of clarify, a little bit about individual states and how they were the ones really driving this?
Yeah, I mean, we keep thinking about shutdown, and quite frankly, we didn't really have like a full like period of complete shutdown. By May of 2020, we already started to re-emerge into society. So it really was just a few months in. The problem is it was like a patchwork. It was so different depending on where you lived. And, the federal government said, you know what, I'm done calling the shots here. Let's just push this to the states and let every state figure it out for themselves. And so then some states started opening up businesses. Some states opened up school back that year. Others didn't. They said, you know what, we're going to do virtual learning for a whole other year. Then you had the mask mandates. And again, it was never really a federal mandate. I think we keep thinking that this was all the federal government. This was all depending on where you lived. And then we started to be pit against each other, right? Well, Florida's doing it this way. Why can't I do it this way?
Yeah, definitely a blue-red divide in sort of how this played out.
Yeah, and then businesses were like, you know what? We can also make our own rules. So let's start, having people have a vaccine card in order for them to show up and clock in.
Yeah, and I think you're spot on about that, Mark. This impression that we had this like lockdown that the federal government imposed on the entire country. I mean, some of it, like you said, in the early days, there were some pretty big statements made by even Donald Trump and as kind of recommended by Anthony Fauci and Deborah Birx. But ultimately, and I think this sort of is the story of America in a way, which is the story of capitalism, right? Ultimately, these were companies and private sector decisions were often made, yes, of course, with the heavy-handed recommendation of public health, but these were companies that were like, look, if you want to come indoors and you want to sit in your cubicle, like you got to get vaccinated. In many companies, there was this vaccinate or terminate policy. So as you know, on the show, we try to talk to people who kind of have this lived experience with mistrust for public health, with mistrust for government institutions writ large. And a couple of days ago, I had the chance to speak with a firefighter from California. His name is Barry Arata. He is a father. He is a devoted husband. And he was told during the pandemic that he had to vaccinate or he would be terminated from his job. And he shared with us the story of what happened when he said no. And this is just a little under 5 minutes. We want you to hear the story of Barry Arata.
I'm Barry Arata, born and raised in the San Francisco Bay Area. Been a firefighter for the last 18 years. I work for a government entity. So obviously I'm a pro-government guy and I enjoy it. I'm a public servant. Love medicine. I love science. Never really had an issue. Wasn't skeptical about, maybe everybody has a little skepticism about, who's really in charge. It's been 5 years now since the pandemic started. My birthday's in the beginning of March. So we made reservations to go out to dinner for my birthday, and it was like nobody was at the restaurant, but nothing had really happened yet. Like there was just this this fear coming that, hey, something's happening. So I said, screw it. Like, if we're gonna die, we're still going out to get a steak tonight. So we go out, we eat, and I think it was a few days later, we're gonna lock Santa Clara County down, and that's the county that I live in. So it was like, okay, was I scared? Of course I was scared. Was I scared for my kids? Yes. Was I scared for my family? Whether you were forced to stay at home or you couldn't travel more than 150 miles from your residence. You couldn't go to churches. You couldn't go to gyms. You couldn't get a haircut. I mean, all the hair salons and the barbershops were putting Christmas wrapping paper and newspaper around their windows so they could stay open and stay alive and subvert being fined and shut down and losing their livelihood. It was insanity here. I was at work, like, hey, jump in, let's go. We're going to go down to the fairgrounds. I said, what are we doing? Training? They said, no, we're going to get the COVID-19 vaccine. I was like, I know, I'm not getting that. Like, like, what are you talking about? I was like, yeah, I had COVID. I recovered. I'm young, healthy, I take care of myself. I don't even know what's in it. I don't even know the name of it. Therefore, I'm not getting it right now. That was that. And it was like, people looked at me like I was nuts. I looked at it like, is this a trial? Is this a clinical trial? Because I don't even know what this is. I understood the panic that had been going on for 9 months, because it was March of 2020 and now you're in December. I understood what has happened. And then if you got out of where I lived in the Bay Area, the COVID didn't exist 200 miles away and people were fine, right? So the vaccines came out in December. There wasn't a mandate till September. But the discussion started in about July of 2021. People starting to say, what if they mandate this? It was, they'll never do it. And I'm represented by a union. And so the executives were, they're not going to do that. We're not going to allow that to happen. No way could they ever do that. It's unconstitutional. Fast forward to July, August, the paperwork came out. I mean, it was vaccinate or terminate right out of the gate. And I was like, whoa, this is wild. Like, this doesn't make any sense. Once they hit that vaccine mandate paperwork and pushed that out, it was like timeout. And I started working with my elected delegates and my representatives who have a fiduciary responsibility to protect all and any members. There's a couple things in my mind is, am I the only one? Am I the only one that is not vaccinated for COVID-19? And I started hearing like there's probably a couple hundred people in your department, which is, little over 30% of the folks. And so I said, fine, that's it. If you're going to do vaccinate or terminate, like, I'm going to step up and I'm going to be a voice for my colleagues that aren't being represented equally. And it was like, we're going to stand, we're going to hold the line. We're not going to do this. These are our moral, ethical, religious, medical beliefs, and these are our constitutional rights. And so it got blurry. And it got weird and it got scary. It's rough, right? So we didn't get terminated. No one got terminated. The union, big champion for that, right? We did everything we could to give you a reasonable accommodation. But we were ostracized and we were alienated and treated differently. If there were another pandemic that happened right now, I said, put the information out there. This is all we know about it. Don't hide anything. Just be honest. Transparency, accountability, and let people make the decision on the risks versus the benefits, the risks versus rewards. That's it. And don't ever mandate anything again.
So that was Barry Arata, firefighter in the California area. It was really interesting talking to Barry. He really opened himself up. There were so many kind of emotions that went through my mind. On the one hand, I'm like you're a firefighter, you're an emergency responder, like, of course you should get vaccinated. And then there's this other part of me that's like, fuck, man, vaccinate or terminate. Like, that's what we're saying to people. I really found myself quite just confused about this whole situation.
It's such a good point. I mean, intellectually, you sit and you think, he talks about constitutional rights. You think to yourself, well, does someone have a constitutional right to catch and transmit to others a deadly infectious disease? Is this really the breakdown of, community, doing it for others, doing something for others? And you go into this conversation and then you hear Barry and you understand that it's a person and he has his feelings and he has his fears and he has his rights. And you respect him and you respect that point of view so much more when you actually hear it and don't just sit in your own echo chamber and convince you and your like-minded friends, what's the right thing to do in all circumstances. You got to meet people halfway. You got to hear their POV. It doesn't mean you change your POV. It's just it begins to build some sort of rapport here.
I really appreciated getting to hear from Barry because during this similar time was curious, why aren't we getting more people vaccinated? The information's there. I'm seeing the webinars about the new vaccines, and it's clear from what Barry said that he wasn't seeing that same information. And, some of the comments he made about wanting all of it at the start makes sense. And while I think it was out there, if it wasn't penetrating to everybody,
he just wasn't ready. I think that's the thing that I kind of he just wasn't ready. Plus, he said he already got COVID. And here's a guy who got his vaccinations from previous times. He's gotten Hep B and all those things because he was an emergency responder. So he is not an anti-science, anti-vax person.
What I heard and the line that stuck with me the most was I'm going to hold the line. You heard him. I'm going to hold the line on this. Yeah. So he kind of said, I'm ready for this, fight. And if you think about it, that's exactly what public health was trying to do. They were trying to hold the line against the virus. And I think that if there's a more open communication, you probably could have got to a point where they were both holding the same damn line, right?
Same
Stop
enemy.
the virus, right?
So thank you so much to Barry Arata. What we want to do coming up next is going to be an interview with, I want to say, the architect for the response, this really interesting response that Sweden had. We're going to be joined with Anders. Okay, welcome back. So look, is there a better way? That brings us to the country of Sweden. Famous for its meatballs, for IKEA, for ABBA. Tom, I know you wrote that because, I feel like Tom wrote that for me. ABBA. I love ABBA. I need everyone to know that. Oh, I fucking love ABBA. Anyway.
No, not that. I didn't know they were Swedish.
You didn't know that ABBA was Swedish? Okay, we're not going to.
You didn't get the research packet?
Anders is listening to this. This is criminal. You're
embarrassing us, Mark.
I know. Meatballs, IKEA, ABBA, and their pandemic response. The guy behind that response is Anders Tegnell. He was the chief epidemiologist for Sweden from 2013 till March of 2022, and he joins us. Welcome to the show, Anders.
Welcome,
Anders.
Thanks a lot.
And you can confirm for us that ABBA is Swedish. I just need to make sure of that.
Yeah, ABBA is Swedish, and music happens to be the major export industry from Sweden these days. So it's not only ABBA. We have a long row of successful Swedish producers and music people.
Okay, see, Anders, you are breaking news today. People think you can only talk about one thing, and here you are talking about ABBA and music exports from Sweden. Now, look, Anders, before we dive in, we want to give our audience kind of the Cliff's Notes versions of how you guys handle the pandemic. So roll with it. We're going to tell you how you handle the pandemic. Go, Tom.
Yes. Here, Anders, listen. So in short, the Swedish government took a lighter touch. We talked about the American approach, which was heavy-handed, but Sweden took a lighter touch. Basically, they stayed open. They didn't shut down workplaces. They did mandate distancing in places like senior living centers and restaurants and bars, but those places stayed open. They didn't mandate quarantines for people who tested positive during the pandemic. Schools for kids like kindergarten through, I think it was 16-year-olds, those schools stayed open. For the older students, there was a brief shutdown, but then a reopen. What they did do was make strong recommendations. They recommended that people keep a distance from others when shopping, or they recommended people work from home as much as possible, reduce travel. And interestingly, outside of healthcare workers and senior living centers, they did not recommend people wear masks. Again, big differences with the American approach, already just in these kind of top line notes. Finally, they did not mandate that people get vaccinated. They used the public health trust among their population to communicate to that population to say, hey, we are looking at this and we are recommending that you take precautions and take care of yourselves. And Swedes do trust public health. There was a poll in May of 2020 that found 80% of respondents had moderate or high trust both in Swedish healthcare and their public health agency.
Wow.
Yeah.
Yeah.
Let's talk about kind of the reaction to all of that. I mean, in the beginning, people were like eyes wide open, like, what is going on in Sweden? People were very critical. Even Donald Trump in April of 2020 basically was going to say Sweden is paying heavily for its decision not to lock down. And then we talk about, oh, how many people died? And there's always this controversy about did they die with COVID or of COVID? And if you just look at the numbers for the first year, right, to March 1st, 2020 to March 1st, 2021, that's most of the time 9 months without the vaccine. Then the last couple months we did have a vaccine, and you look, well, how did Sweden do? Or how did America do? And there's this thing called excess deaths, which is the sort of a weird word because like excess of what? Like how many deaths are okay? But the excess deaths means how many people more died than you would normally expect in a regular year. And in America, when after it was all said and done, we had twice as high that number as Sweden. So in the US, we had an additional almost 1,800 deaths per million people, where in Sweden, it was just 870. So Sweden did a lot better in terms of that metric of excess deaths. But if you look at, let's say, compared to France locked down, Sweden didn't, but their excess deaths was the same. And then you have Germany, they locked down, but they did a lot better than Sweden. And then you have Norway, their neighbor, and they basically locked down and they did incredibly well, better than Sweden. So Sweden did remain the most open. And, you know, like Tom said, businesses and schools weren't like shut down like they were and so restrictively in America. And what we're really facing, and the reason why we want to talk to Anders, is because we did all of that and we're really dealing now with the collateral damage. So
it's like Sweden got through it, made it out the other end, you know, did fairly well, but didn't have all of that collateral damage, all of the psychological damage, the economic damage, the learning loss, all these things that are really, were devastating in America. So the question is, you know, well, there's many questions, and that's why we have Anders.
Anders, we're thrilled to have you. So look, I want to start off by just quoting something that the Swedish Prime Minister said, I think it was back in 2020, when you guys were just setting up your response. And they said, our government agencies and our healthcare system are doing everything they can. And this is just when the pandemic had happened. However, they went on to say, every person in Sweden needs to take individual responsibility. If everyone takes responsibility, we can keep the spread of the virus in check. I was really struck by that phrase, individual responsibility. So Anders, we've thrown a lot at you in the last couple of minutes. Just kind of tell us your thoughts, and particularly this idea of individual responsibility.
No, I think that comes back to that the pandemic is not really something handled by our healthcare or even public health authorities or the political level. It's really a whole of society kind of thing. And to me, that means you need to get the whole of society on board. So it's not only the individuals you need to get on board, you also need to get all private enterprises, different kind of agencies. Everybody needs to join in handling this. And I think that was what it was all about and what our prime minister really meant.
Anders, how do you think it went in Sweden? I mean, if our memories are right, things got off to a really rough start in that first year. And then as we hit the fall of 2020 into the winter of 2020, suddenly things were going a lot better. Do you agree with that assessment?
Obviously, we had problems, especially in the beginning. One thing is that we need to keep the whole pandemic in perspective when we talk about this. And if you draw out the excess deaths, Sweden turned out even better. I mean, we are definitely always among the 5 countries with the least excess death in Europe, and sometimes the country with the lowest, if you look at the 2 years of the pandemic, including the vaccine year. So pandemic is a marathon, it's not a sprint. So you need to be able to handle it over time. And in the beginning, we had huge problems with our elderly homes. And I think that's part of the reason why we still after that heavy start could sort of see that, okay, things didn't go completely wrong. It was our elderly homes, which in Sweden are very, very special environments, housing some 10,000 people out of the 2 million people that are above 65 million people. So it's really quite exclusive. And you only really go there in the very end of your life. Most people spend only like 6 months in those kind of institutions. And most people never go there because it's really for a very minor part and a very fragile part of the population. And unfortunately, they are not medical institutions. They're very much social institutions. So they're very much focused on providing a good place to live during the last months of your life. neither trained nor equipped to deal with any kind of medical emergencies. And that showed very well. And I think we had like 70% of the deaths in the first spring took place among 10,000 people. In a way that made us still feel we are going the right way. I mean, the death toll was not spread over the population. It was definitely not among young ones. It was very much in environments where we knew that we had a problem. To us, it did not disqualify what we did. We still felt confident that we did a lot of the right things.
So let me jump in and ask you about that. So if someone says, and again, please forgive me if I'm getting my numbers wrong and jump in and tell me and please correct me. But so you look at a country like Norway, which my understanding is that first year they had something like 500 deaths or thereabout, maybe 500 or 600. And you guys had closer to 10,000. But for you, you can still look at that number and still see success in your approach. Tell me a little bit about that.
Yeah, I mean, first of all, Norway and Sweden and Finland are countries that are very, very different. I mean, Sweden is much more a middle European country. Most of our population lives in cities. We are very densely populated in the part where people live at all. While in Norway and Finland, people tend to still live on the countryside to a great extent. And we know that during the first year, at least in Europe, the pandemic was very much focused on the cities, on the big cities, and they were really badly hit, especially Stockholm, which is very densely populated. So I think that you need to understand that in Europe, Norway and Finland was the outliers. Sweden was a normal European country with about the same mortality and the same hit of the pandemic as most other European countries. And there is also a notable difference, as I was alluding to the countries that got a huge first influx of sick people. Sweden was very unlucky because we happened to have our winter holidays in February and March 2020. And 2 million Swedes leave the country. 20% of the population leave our country and goes to other countries. And a lot of them came back with the disease. So our introduction was immense. And that was not at all the case in Norway and Finland. Their introductions were very small. So they could keep on working with trying to keep the pandemic down. But we were overwhelmed within a week. Our hospital services called us and told us we cannot test and trace anymore because there is no way we can test and trace all these 2 million people. And we need to take care of mounting amount of people that actually needs hospital care. So we were in a completely different situation compared to Norway and Finland.
I wonder if during the pandemic you were watching countries like America and their response to lockdowns, mandates for masks, schools being closed. Did you think, wait a minute, did I miss a memo that everybody else was getting? Or what are they basing these moves on? Or was it something different in your mind?
No, but I mean, it's not only the States. I mean, most countries went that way. And I think we really wondered, where do they get the confidence in that that's going to work? And how do they think it's going to be possible to do it? I mean, not least lockdowns. I mean, we did a lighter, but I will also say more focused lockdowns. We locked down things that we really thought were dangerous, like restaurants, like big events, big congregations of people, but did not lock down places we knew could keep on open, like most workplaces. Actually, and instead we gave them a lot of advice, and we can look back and see that companies like Scania, one of the big truck builders in Sweden employing thousands of people, they actually had a lower amount of people being sick than people staying at home because they really managed their workplace in a very, very good way. We found, but for restaurants and for big concerts and so on, it was just not possible. So we closed them down and we left the things open where we could believe that they could handle it in a way that did not threaten a massive outbreak.
Were you basing this on literature, and how much effort went into these decisions? How were they informed? I mean, I think I saw one of your talks and I think you even made a joke did you just guess? Did you just guess right? It was a multiple choice. You could either choose lockdown, not choose lockdown. Let's do with a not, and let's see what happens.
I mean, there's no evidence, of course. I mean, nobody ever tried it before. So how can you talk about evidence? But what we very much based it on was on our data flow. And the data flow is quite quick. So we could very quickly see where things did spread in Sweden. And we also got a lot of good information from other places like Austria and Italy and so on. about big events being dangerous, restaurants being dangerous, and so on. And some people still criticize us because we were a bit slow in doing things, but it was very much because we wanted to sort of see what happened and then quickly do something. Case data we get within 24 hours, mortality within 2 days.
Let me ask you, Anders, in the United States, I think when people talk about your country and the pandemic, it ends up being kind of a Rorschach test for where people fall politically. You've got one side that views you and Sweden, and a lot of them tend to lean right, think of you as a hero. Think of like, look, this is what happens when you let people just give them the personal responsibility and let them make their own decisions. And then you've got the other side being like, Sweden had death. Like, we don't want that much death. And so just to kind of address both of that, you know, particularly you becoming a hero amongst folks who in our country are kind of coded right. And I hate even describing it that way. It's just kind of how it's ended up being. I see a lot of value in how they think and how they believe. So tell me what you say. Like, do you think that's a fair assessment? Like, how do you view that? How people view Sweden?
Yeah, it's interesting how political this became in many countries. In Sweden, it did not become political at all, I would say. And of course, we are not basing any kind of our decision on any kind of politics. I mean, we are basing it on what's best for public health. And letting people take responsibility and make the decisions that are best for them is usually the best way to get people to change their behavior so that they can have a better health. When it comes to smoking or whatever. I mean, you can do other things too. You can increase prices but stuff like that. But eventually it comes down to the individuals actually taking an informed choice. And if you can get them to take an informed choice, they usually do the effective thing for both them and for society. So I think it's very much about that. And that is, I would say, in a way, almost contradictory to the right-wing political movements, because we are really working on getting a society where there is a lot of, I mean, people really want to help each other. I mean, there's a lot of that in the Swedish approach, because most people in Sweden understood very well. Staying home from work, not because I'm afraid of being sick myself, because I know that this disease is not going to hurt me very much. But I'm staying home so that the spread in society will go down and the elderly people in our society will have a better life.
But Anders, what do you do for the people who aren't on board? I think that's the question. It's like, you know, if we look at a vaccine rate, you know, 95% of the people will get a vaccine, but the 5% that don't is how an outbreak could start. Like, I'm curious, like your approach sounds amazing, but you're a realist at some point, I'm sure, as a doctor. What do you do with the people who are like, all right, I'm good. I'm not dealing with that?
I mean, when it comes to pandemic, you're never going to get 100%. I mean, you're never going to stop it. I mean, this whole idea that was, and I just read a report from Norway, which very much talked about stopping the pandemic. We never talked about stopping the pandemic. We talked about getting the pandemic and the spread as low as possible so that we could go on living and that we could live through this in a reasonable way. And I think that's what it comes down to. You're never going to get everybody to do exactly the way you want. But if you get 85% to do it, you change the whole pandemic, because suddenly you are going from having a R0 being 2, 3 to having an R0 that is almost 1. And that will make such a big difference, because the spread will go down from doubling every 3 to 4 days to basically being stable. You're not so concerned about each individual anymore. You're concerned about your population. And if you can get 80% of your population to move the right way, that's usually enough to have a huge impact on the public health in your population.
I just want everyone to know that I know what you mean when you say are not, and I didn't always know that, but I know so now. As somebody who failed
Tell
chemistry,
us, Brenda. Tell us.
R naught is like the number of people who can get it.
No, R0 is the number of people.
Damn it!
Sorry about that. I need to correct you.
It's close.
R0 is the number of people that one sick individual will infect and will get sick.
Whatever.
Yeah, R0 is for measles is around 12, 13.
Yeah, that's high. But Anders,
threefold.
let me jump in. Let me jump in. You're right. I should not. No one like quiz me on R not. Okay, I'm not ready. But let's talk for a second about trust, because here's the thing that I find, and I'm just going to be very expressive for a second, fucking remarkable about Sweden. Okay, that there was a survey that showed that after the pandemic, trust levels actually went up in Sweden for their government and their public health officials. And that I want to get this right. So that this one study showed Swedish citizens reported a high level of trust in their government to protect them during the pandemic. And they also reported a high level of perceived risk from the virus. Let's just talk about the role that trust played for Sweden in this pandemic, because I'm going to be honest with you. When I see that not only did folks trust you guys, but they also trusted that the virus was dangerous, that's something that really fundamentally gets at something that is an issue in our country, which is that for a huge swath of this population, there was the sense that this virus was not as dangerous as it was being made out to be. So talk to us. It felt like in Sweden, people sort of accepted that. It just didn't necessarily result in like the shutting down of things, but people agreed that COVID was dangerous.
Yeah. At the same time, most Swedes did not say that they were afraid. I think there is a difference between having a respect for a disease and try to avoid it as much as possible and being afraid. And it's also very much about trust and communication during a crisis. You need to get people to be concerned and understand we have a serious situation, but not be scared, because when you're scared, you stop being logical. You stop doing the sensible thing. I think we really tried very hard to reach a level where we get good information, to get people to understand we're really in a serious situation. We really need to do something about this. But at the same time, get them to understand that you should not be scared. You should be concerned. You should be really respectful. You should try to do your best to avoid getting infected. But don't run around being scared, because that's not going to help anybody. And we were criticized in the beginning, saying that we downplayed the risk of COVID-19. And actually, we didn't. When you look back at it, I mean, we said it's slightly more dangerous than flu, but we are not way off. We're not talking Ebola or something like that. We are talking a disease that is not really all that far away from the normal respiratory diseases that we see around us. But a lot of us are going to get sick at the same time, and that's going to be the problem. Not that the individual risk is all that much different than for the yearly flu epidemics.
And just tell us a little bit about the spirit of sort of community. You mentioned, you need to help and work with people to make an informed choice. And you want to get to a place where you hear people saying, I'm staying home because the spread in society will go down. It feels like in America, we're moving further away from that. There's more of an individualized risk assessment. What's it for me as versus I do this for others? We heard earlier in this episode from a firefighter named Barry, who was very unsettled, very nervous about the vaccine, and said he had to hold the line and not take that vaccine when it was mandated that he take it. Just tell us a little bit about this kind of spirit of community that you see in Sweden, but also look at America. And if you can you diagnose a little bit about what you're seeing vis-a-vis community here?
No, I think that we're also talking about that even in Sweden, people are becoming more centered on the individual. And to me, it was fantastic to see during the pandemic, it was not really like that. This old-fashioned way of caring about your neighbors and your family and the society at large is still there. Maybe not everyone, but definitely among a big part of the population. It's still there, that we can sort of see that it's important that we do things together, and the spirit in that. The US has a completely different kind of history than Sweden. I mean, you were formed by a lot of migrants not so long ago, only a few generations back. Many of them left Europe for many reasons, that because they couldn't get the freedom they wanted and so on. So you have, in Sweden, I mean, our country has been formed by a fairly homogeneous population for a long time, until the last 20 or 30 years. Now we have a lot of migrants, but still the society was formed by fairly uniform population, fairly uniform kind of government. We had like 50 years of a social democratic ruling that really built.
And you have universal health care and free comprehensive elder care.
Yeah, exactly. With all of these things not even debated, not even
Right.
by new far right parties. They are the ones protecting it more than everybody else. That society has responsibility to the individual to make it possible for the individual to live a good life, a life with a lot of individual choices and individual responsibility. But the society really has that responsibility, and that's why we need universal healthcare. We need a reasonable pension system. Yeah, we need to be able to live even if we lose our work and stuff like that. And
God,
I
you
think
sound like a freaking communist, Anders. Just stop it. Let me ask you something, because
that's what Sweden has been called in the US for many years. So
yeah, exactly.
I was a student in the US many years back, and most of my teachers is wondering why communists came to the US.
Well, you're a very mild-mannered communist. Anders, we sent you the interview of Barry Arata, and I want to ask you something about it. There's something that actually he told me later. It didn't make it in the cut, but he said he thinks that if the vaccines weren't mandated, that the compliance rates actually may have been higher. And I find that really interesting. And I just put that to you for a second. Look, it's all speculation. We have no idea. Hindsight is 2020. Tell me what you think about that theory.
Yeah, I think there is some reason to that. I mean, I think a lot of people feel that when you mandate something, there is nothing in it for me because I need to be forced to do it. If you give them good information, good understanding on why they, as an individual, should take it to protect themselves, but also maybe to protect their elderly relatives and so on. They have an easier and better understanding on that there is a win-win situation in this. Usually mandate comes because you need to force people to do something they don't going to gain anything from. And I think in Sweden, vaccines have never been... we mandated smallpox vaccine some 40 years ago in a completely different kind of context. But since then, we never have a mandated vaccine. And the vaccine compliance in Sweden is incredibly high. And our belief in vaccine among the population is really high. So of course, we have groups in social media and so on questioning it, but in practice, it doesn't make any difference because still 98% of all kids in Sweden are vaccinated every year.
So you don't have like mandatory school vaccinations? Like there's no mandate to get, say, the measles vaccine or something?
No, I think the way you do it in the US, which is quite interesting, is that it's not mandated to get vaccinated, but it's mandated to go to school. And to be able to go to school, you need to be vaccinated. I think that's a roundabout way that I remember when my brother moved to the US, I had to write papers about his kids being vaccinated in Sweden with a lot of stamps and stuff for his kids to be able to go to school.
So to go to public school in just so I'm clear, to go to public school in Sweden, I guess it's all public because you're a communist country. To go to a public school, you don't need to be vaccinated, but the country is still majority vaccinated.
Yeah. And a lot of our schools these days are actually private.
All vaccination in Sweden is voluntary. Like, so you're not going to stump in and say, wait a minute, family, you can't come into the school if you don't do this. We've given you 5 warnings. Like, it's all just communication.
Yeah. No. And of course, in the Well Baby Clinic, where all kids are registered, if you come there and your child is not vaccinated, yes, the nurse will start asking why not, and do you want more information? How can we get you to understand it would be really good for your kids to get vaccinated?
Yeah, I've heard you say that the framework that you use in Sweden is, we'll tell you where to go, but we won't tell you how to get there. That's on you. Yeah, I think that's super interesting way to look at it. And, it requires that you also trust, the population. One thing we didn't get to talk too much about, and I don't know we need to get into it, but just important for everybody to remember, it's almost like we still have 2 pandemics though. Like a lot of what we talked about is the pre-vaccine era and then the post-vaccine era. And I wonder how you shifted your mentality when you didn't have a vaccine versus when you did have that tool. And especially moving forward, what are you thinking about in terms of planning for, let's say the next pandemic?
I think the shift when the vaccine came was maybe less dramatic in Sweden than in the US. Maybe partly because vaccines is such a natural thing for many Swedes. So there was no big thing. Everybody was just happy it came. But it didn't really change very much of our recommendations, anything like that, because we found out early on that, sure, the vaccine will stop you from having to go to the ICU when you get sick, but it will not stop you from getting COVID and it will not stop you from spreading it. So, which means that most of the things we had in place needed to keep in place to protect the small part of our population that will not be protected by a vaccine, like the really elderly, really frail people. And we never went for a vaccine mandate. We never forced people to show a vaccine certificate, except if they needed to travel somewhere and the country demanded it. So it was possible to get a vaccine certificate, but it was never enforced anywhere in Sweden that you need to have a vaccine certificate before you could go places and stuff like that. So in that way, I think Swedes will not, the same way as you do. I think you feel that it was such a big difference when the vaccines came. No, didn't really make all that much of a difference.
That is crazy to hear you actually verbalize that the vaccines didn't make that much of a difference. I mean, talk about just two ways of looking at the same thing. We were basically, this is the be all end all path out of the pandemic. And for you, you're saying you guys just, it was just one more thing. We were already on a good path.
Yeah, and of course, it made a huge difference to our health services. I mean, the hospitals, the third wave in Sweden would have been really bad without vaccines, and the hospitals were really struggling already. So they were, of course, quite happy because the number of people who needed intensive care went down considerably. But I think for the population at large, not a major change in the pandemic for them.
Anders, I think that's really interesting. And I might just circle back to differences between American and Swedish healthcare. When people say here in the US, in the next pandemic, we should be more hands-off like Sweden was. How do you think about that in terms of the structural differences there versus how you approach things, Sweden approached things, and if any of that could have worked in the US?
No, but I think hands-off is definitely what we were not. We were incredibly hands-on. But we tried to focus our interventions on where we thought they were necessary. And I think that's what we really learned. I mean, in a pandemic, closing down everything and closing down society as a whole, that is not a good recipe. I mean, it can help you for a few weeks now and then, but on a 2-3 year long pandemic, it's not going to work. So you need to find out where you need to focus. And we found out early on, okay, we understand that most people get infected in their workplace. So we try to stop as many people as possible to go to their workplaces. And we also understood that big events can really be a big problem because so many people get infected at the same time. We saw that from South Korea and many places. So no more big events. And I think that's the kind of information we really need early on in the next pandemic, so we can focus our interventions much better than we did this time, when we in sort of because everybody was so worried and scared, we tended to close everything down. Instead, try to close down where you need to close down, and don't stop people from going out doing their morning run, because it doesn't make any sense.
Anders, we set up this episode as sort of in the event of and the eventual event of a future pandemic coming. Sort of, what does America want to be? What do we want to do? What is our response to this? And there's the heavy-handed way that we did it with mandates and requiring vaccines, et cetera. Then there's this Swedish example of trust everyone to do the right thing, give them information. They will protect themselves. They'll protect their community. It sort of dawns on me as we talk more about this. I think it's a false premise. I don't think we really have a choice. I think maybe the framing of this episode really is, we did it one way during COVID. It went down poorly with the American public. We don't have that opportunity to do it that way again. We're all going to kind of go Sweden in the future. If I'm right, what is your biggest piece of advice to public health in America about how to pull off the Sweden model if, God forbid, we have to go through this again?
We're going to go through it again. We just don't know when, and hopefully it will take some time, but we never know. I mean, to me, it's become more and more clear that the context is so incredibly important. With what do you go into a pandemic? If you go into the pandemic with a good public health, like people being reasonably healthy, the people with chronic disease are on good treatments and so on, and stable in their chronic diseases and so on, like we have it in the Nordic countries, it's so much easier to handle because the risk for people is going to be so much lower So that's going to make a huge difference. And I think that's really one of the major things that really made a difference for the Nordic countries, that we started out with a very good public health, with a good health system, universal health system that really reaches out to everybody and was really flexible enough to take on this new challenge without losing focus on that they also need to keep on doing what they normally do to keep people with diabetes and high blood pressure and stuff like that reasonably stable, so that we don't lose. You need to focus on two things at the same time. So I think that's really important, and you need to have that, build that up before a pandemic. That will make life so much easier during a pandemic. And then, of course, you need to build up trust. And trust, as we have been talking about, is very much a two-way thing. You need to trust your population, and the population, you need to get the population to trust you. And that takes a long time. And it usually, you need to show the population that you really want something that's good for them and give them really good information about that. Not just telling them to do things, but instead telling them these are the risks with your food, with your smoking, with your alcohol, and this is how you can minimize the risks and all of that. To get it more into a dialogue and try to understand. Like, I think when I read the transcript from this fireman, what he was missing, I mean, he didn't get good information. He didn't have the complete picture clear to him. And that was why he became worried and wondering, is somebody trying to hide something from me? Why don't they tell me everything? When you get that kind of feeling, you tend to take the wrong kind of choices.
Anders, that's so...
It's a long haul, and you really have to constantly show whoever is supposed to trust you that you really mean well, and that what you're doing is based on maybe not always scientific evidence, because it's not always there, but at least the best available knowledge. And you're never trying to hide anything. If you're uncertain, be very clear about that you're uncertain, and tell them clearly, okay, this is what we know today. Especially during a pandemic, within a few weeks, we might come back and say something different. And it's not because we were lying last time. It's because we have got new information. We're going to tell you about the new information, and that slightly changes the way we view things. I think this is about honesty, transparency, showing goodwill, and trying to understand what people are really wondering. Because I think that sometimes we miss also in Sweden. And I think that's what social media is so good about, because that at least gives us some kind of inkling about what are the big questions going on out there. And I remember before each of our press conferences, our media people always came to us and told us, okay, these are the big things that are circling in social media right now. It's good if you address this and this question.
That's a smart move.
Yeah.
You mean you guys were actually trying to listen and find out what the people were worried about?
Yeah, I mean, that's what the whole thing is about, isn't it?
Yeah.
I think also that you have to understand that how do you earn trust knowing that I'm going to be wrong sometimes, knowing that I'm going to make a mistake sometimes, and I still want you to trust me.
Right.
That I think is really also how we move forward, because if the expectation is I'm going to earn your trust by showing you I have goodwill and I'm always going to do right and I'm going to be honest with you, we are missing that I'm going to be wrong. But you know what? I'm wrong, and I still want you to trust me. And I think that's going to be the really hard part.
Yeah, but if you come back and tell them, sorry, last week or last year, this is what we thought. We were wrong. Now we know better.
Yep. Great. We solved it. Awesome.
Anders, you know, it's funny. I don't always feel this after every episode. Sometimes it just reminds me how kind of hard life is. But the truth is, I actually leave feeling quite inspired. I think that I've really learned quite a bit. And I've learned that, like, as a society, we can go through very difficult things. We can even experience loss of life and really difficult things and come out the other end and still trust each other and still feel like we can, do better the next time, but not in a way that really divides and polarizes us. And I really hope that, like, we can stay in touch, if, like, that you can be our, like, what would Sweden do? And look, I also just want to make clear that we are very different countries, and there are things that you guys have that it wouldn't work here, quite honestly. But the truth is, we got to have these conversations. So thank you, Anders.
Thank you.
Thank you so much.
Thank you for having me. Great talking to you.
We're just going to leave saying thank you for the wonderful Swedish meatballs, for IKEA, for ABBA, for these producers. I'm going to go look up all these cool Swedish music producers. And Anders, thank you for you. I think you're a really smart guy, and you're a pretty cool export from Sweden as well. With that, that is the end of our show. Please hit like, subscribe, rate, review, all that stuff. If you're offended by all my Swedish stereotypes, listen, they're positive, okay? I'm saying good things about Sweden, so just chill. Yeah. Please send questions at whyshouldItrustyou.net for questions, comments, all that good stuff. I am Brenda. He is Tom. She is Maggie. He is Dr. Mark. That was Anders Tegnell on our show. We'll see you right back here next week.